Exilis is a radio frequency technology that is made to tighten the skin as well as to attack the upper layers of the subcutaneous fat. And there we try to reduce fat and we try to tighten skin. The main thing that was so important for me to use the device is that we are based on studies. Studies that are not available for other devices, and this is a very, very big and important argument for me, that they do not only claim to do something, they prove their aims and their recommendations. So the Exilis, as I said, is a radio frequency technology. So what it does is that it's a very fast plus-minus change, like we see in the microwave oven, the gigahertz range, but we work here with radio frequency, which means it's another range in the radio field, which uses the impedance in the depth of the tissue. So there's a different impedance in the corium, in the dermis, and in the fat, and in the upper layers of the skin. And this is how radio frequency works. We can easily heat up different areas within the skin. So the dermis or the subcutaneous, so the fat, and so we can attack the dermis, heat it up to get wound healing reactions, which are going to tighten the skin, or we attack with heat the upper layers of the subcutaneous tissues to attack these areas to get rid of too much fat in this part of the body. The Exilis has very different indications. So we can use it for wrinkles under the eyes, this tiny wrinkles under the eyes, very thin skin. We can use it in the face itself. We can use it for the neck skin, which is a big issue for a lot of people. We can use it at the abdomen. We can use it for the bingo arms. We can use it for striae and for all the other areas thinkable where it's needed to tighten the skin and to get rid of excessive fat. So what we are doing here, we go after the fat by heat, and the same we do with the wound healing processes within the dermis to tighten skin with this device. We have different applicators with different sizes, with different penetration depths, and we have also a very special applicator that we can use in the vaginal area, so to tighten the introitus vaginae of a woman, just to do something for continence, so that their tightening of the introitus is much better, again done by heat. We combine the device very often with the so-called M-Sculpt, not a radio frequency device now, it's a magnetic device, just another frequency, and the M-Sculpt works with the muscle. It compresses the fat by acting within the muscle. And what the Exilis does, it causes by heat apoptosis, and the M-Sculpt squeezes the fat cell. At the end it does something similar, but on a different pathway. And therefore the combination of the two devices, heat and magnetic fields, is very interesting. There are not clear defined contraindications for me. So the contraindications that we know are for sure any skin disease. If you have an eczema or psoriasis or something similar at the skin, nobody will think about to treat this area within such a patient. So all the patients who have fine skin, are normal healthy, don't have any contraindication. Also a pacemaker is something we will never use it above a pacemaker, but nobody has this idea. So if you take a little bit care, there is no much that you can do with the patients, that you can harm the patient. So what we need is that we need to get the tightening of the skin, as the other thing is to think about is to go after the fat. How we do? So we widen the vessel a bit, so it causes a little bit redness. So the cell then delivers some protein-rich plasma to the surrounding tissue. We have some swelling, and this edema causes wound healing reactions. These wound healing reactions, that little tiny wound healing reactions that we had getting by the plasma, are finished about 7 to 10 days. So we normally treat the patients every 10 to 14th day with the Exilis device to get best results. We use this normally 4 to 10 times. The need is we try to see something. If we are fine after 3 treatments, we end with 3 treatments. If we need more, we see this. The good thing is that we all the time can stop a treatment period. I said it now several times, we are aiming on wound healing reactions. So the wound healing reactions must be finished until we can see really results. So the edema causes that we don't see the wrinkles anymore. So edema is a fake result. So the edema must be gone completely, and then the wound healing must be finished. So this will be true after 6 weeks or so. The same is true for the apoptotic reactions that we see in the fat tissue also. This takes about 6 weeks until they are finished. So normally we tell the patients you see results after 6 weeks to 3 months after the last treatment session. So the results should last at least for 6 to 12 months. But normally we see some results that are lasting longer. It differs a lot between the circumstances that you have in your certain life. So if you go to the sun too much, if you drink alcohol, you work 12 hours, or you're a smoker, or whatever, all this has influence of the result that you can get after such a treatment. This is true for all treatments. It's true for lasers, it's true for facelifts with a knife, it's true for everything. It differs a bit. But the normal patient is happy with significant results about 6 to 12 months at least.